Welcome back to our channel, where we share the latest news and untold stories about Catherine, the Princess of Wales, and her royal family. Today, we bring you breaking news. A doctor specializing in chemotherapy has disclosed a distressing transformation in Catherine, causing William to become emotional throughout their ongoing struggle against cancer. The courageous Princess of Wales disclosed her cancer diagnosis. However, she assured everyone that her health was going to be okay. Princess Catherine, 42, underwent a scheduled operation at a hospital in London in January. She subsequently went back to Windsor to complete her rehabilitation. The tests conducted after her procedure revealed an unidentified type of cancer to the doctors. Next, she had a chemotherapy treatment. Despite the fact that the diagnosis came out as a tremendous shock, Princess Catherine is currently undergoing the early stages of prophylactic chemotherapy treatment. Princess Catherine received the shocking news of her cancer diagnosis a month ago. The palace recently informed everyone that Princess Catherine's health has significantly improved over the last month, and that she's eager to resume her responsibilities as soon as possible. A member of Catherine's team, a chemo doctor, revealed that Princess Catherine has faced a tragic reality in recent months. The conversations between Princess Catherine and the chemo process specialist are detailed below. Most often, doctors use chemotherapy to either directly cure cancer or to shrink a tumor in preparation for surgical removal. Chemotherapy is a potent medicine that attacks tumors. Princess Catherine received chemotherapy, and we can use it as a preventative measure to stop the cancer from coming back. Catherine, 42, successfully received the prophylactic kind of chemotherapy, according to a message she released. Late in the month of February, she started the therapy. At that moment, everyone seemed to agree that Catherine's operation was for a non-cancerous condition. According to her statement today, testing revealed the presence of malignancy. After receiving the recommendation to start a prophylactic chemotherapy course, Catherine stated that she was currently in the early stages of that treatment. If the patient has successfully removed the primary tumor from their body, the goal of preventative treatment was chemotherapy, also known as adjuvant radiation therapy, and it's to prevent the disease from returning. It's possible for cancer to grow and spread across different areas of the body via a process known as metastasis. This occurs when malignant cells divide from the primary tumor and take residence in different areas of the body. Such new malignancies may be difficult to detect, which is why oncologists, who are medical professionals who specialize in cancer medical management, frequently recommend that patients receive prophylactic chemotherapy in an effort to eradicate any signs of the illness that may still be present. One of the most common ways that preventative chemotherapeutics are administered is by an intravenous drip or pills, which are subsequently absorbed by the circulation and distributed through the entire body. Depending on the type of chemotherapy, a patient may receive it at a healthcare facility or at their home. Chemotherapy medications come in hundreds of different varieties. However, they all function in a manner that's comparable and are absorbed by the bloodstream. It's important to note that the medications are cytotoxic, which means that they may be harmful to cells, particularly those that proliferate fast. Chemotherapy frequently serves as a form of therapy for cancer because it has a greater impact on cancer cells, which proliferate more frequently than healthy cells. However, this procedure also causes harm to other cells and are capable of very rapid growth, such as those found in the skin, bone marrow, hair, and the outer layer of the gastrointestinal tract. This results in a number of well-known adverse effects associated with chemotherapy, including hair loss or thinning, exhaustion, increased resistance to bruising and hemorrhaging, a greater likelihood of getting sick, diarrhea or constipation, nausea and vomiting, rashes, and various other symptoms. Patients receiving chemotherapy often take additional medications to alleviate or counteract certain aspects of these effects. The head scar measures 3 inches. As a result of the injury she sustained as a youngster, Catherine now sports a 3-inch scar on her cheek of the left. Her childhood operation was positively identified as the cause. The scar relates to a childhood surgery, according to an administrative declaration, which also stressed that the specifics of the procedure were non-public. The procedure was very serious, according to royal insiders who would not elaborate. Currently, surgeons speculate that a birthmark, not a tumor, may have left behind a scar. Experiencing morning sickness. While expecting Prince George in 2012, the pregnant princess spent a week in a medical facility due to severe morning sickness. For nearly a century, the royal family has frequented King Edward VII's hospital in Marylebone, where she received treatment. Catherine once again experienced hyperemesis gravidarum during her pregnancies with Princess Charlotte in 2014 and Prince Louis in 2018. Because of her illness, the princess announced the news of her subsequent second pregnancy before they reached the critical 12-week mark. Nevertheless, she received treatment at Kensington Palace instead of a medical facility when she discovered that she was pregnant with Princess Charlotte and Prince Louis. Because they have trouble swallowing, mothers and babies afflicted with it are in danger of suffering from severe thirst and missing out on essential vitamins and minerals. The potentially dangerous and draining effects of having to vomit at least 30 times each day are real. Using techniques like deep relaxation and meditation, Catherine was able to manage her health issues, which she disclosed in 2020. Stomach resection. After spending 2 weeks in hospital recuperating, the princess had her anticipated significant abdominal procedure in January. Catherine returned to Windsor to be with her family while she continued to heal after her hospitalization at Marylebone's London clinic. There was a lack of information on the procedure, although doctors initially believed her disease was non-cancerous. The doctor recommended that she rest for at least 2 or 3 months. Her disappearance from view sparked many baseless conspiracy theories and a digital media frenzy. More than one employee of the London clinic allegedly tried to obtain her medical information, and the medical centre is now investigating the allegations and has dismissed 3 employees. Cancer detection. Today, the princess made public her diagnosis of an unnamed cancer and the fact that she is now undergoing treatment for it. There was no confirmation of malignancy in her tests, leading to her abdomen surgery. However, tests conducted after her procedure revealed the illness to the physicians. Catherine stated in a video message that the doctors treating her recommend that she get prophylactic chemotherapy. According to her, she's focused on her mental, physical, and spiritual health, and she's becoming stronger every day. Additionally, Catherine honored those whose lives the cancer has touched. And no matter how you're dealing with this illness, I beg you, keep believing. You have company. I sincerely appreciate you taking the time to watch today's video. For now, we would appreciate it if you could share your ideas with us.